Imagine the worry of your baby struggling to breathe. Respiratory Syncytial Virus, or RSV, is a common threat that can cause serious illness in infants. But now, there's a new tool to help protect them. RSV is a common respiratory virus. It usually causes mild cold-like symptoms in adults and older children. However, for newborns and infants, RSV can be much more serious. It is a leading cause of lower respiratory tract infections like bronchiolitis and pneumonia in young children. These infections can be severe, sometimes requiring hospitalization and intensive medical care. Protecting infants, especially those at higher risk, is crucial during RSV season. Enflonsia Clesrovumab C4 is an FDA-approved medication. It is specifically designed to prevent RSV lower respiratory tract disease in newborns and infants. This medication offers a new way to provide protection during their first RSV season. Enflonsia provides rapid and long-lasting passive immunity. This means it gives the baby protective antibodies directly. These antibodies help defend against the virus and reduce the risk of severe complications. Enflonsia is a type of medicine called a long-acting monoclonal antibody, MAB. Monoclonal antibodies are laboratory-made proteins that mimic the antibodies our own immune system makes. They are designed to target specific parts of a virus. Enflonsia works by targeting the RSV F protein. This protein is essential for the virus to enter cells and multiply. By binding to the F protein, Enflonsia stops the virus from infecting cells. This action helps prevent the virus from establishing a severe infection in the lungs and respiratory passages. Enflonsia is approved for the prevention of RSV lower respiratory tract disease. It is indicated for neonates and infants. They should be born during or entering their first RSV season. The active ingredient is clesrovimab-cfor. Its purpose is solely preventative, not for treating active RSV infection. It provides protection throughout a typical RSV season. The FDA approval of Enflonsia on June 9, 2025, was based on positive results from a clinical trial. This trial, known as CLEVER, mcqs, evaluated the efficacy and safety of Enflonsia. The results demonstrated significant protection for infants. The CLEVER trial showed an 84.3% reduction in hospitalizations due to RSV. This highlights Enflonsia's ability to prevent the most severe outcomes. It significantly reduces the likelihood of an infant needing hospital care for RSV. Furthermore, the trial demonstrated a 60.5% reduction in medically attended lower respiratory infections, MALARI. This includes conditions like bronchiolitis and pneumonia. These results indicate that Enflonsia helps prevent less severe but still concerning respiratory illnesses caused by RSV. Enflonsia is administered as a single intramuscular injection. The recommended dose is 105 milligrams. It is given into the muscle, typically in the thigh. The timing of the injection depends on when the baby is born relative to the RSV season. For babies born during the RSV season, Enflonsia is given once, starting from birth. This provides immediate protection as they enter the high-risk period. For babies born outside the RSV season, Enflonsia is given once before the start of their first RSV season. This ensures they have protection when the virus begins circulating. The single dose is designed to provide protection for approximately 5 months, covering a typical RSV season. Infants undergoing cardiac surgery with cardiopulmonary bypass during or entering their first RSV season require special consideration. Cardiopulmonary bypass can affect the levels of monoclonal antibodies in the body. Therefore, an additional dose is recommended. An additional 105 milligram dose is administered as an intramuscular injection. This dose should be given as soon as the infant is stable after surgery. This helps ensure adequate clesrovimab-cfor serum levels are maintained for continued protection against RSV. Like all medications, Enflonsia can cause side effects. The most common side effects observed in the clinical trial 004 were generally mild. These included reactions at the injection site. Injection site redness was reported in 3.7% of patients. Injection site swelling occurred in 2.7% of patients. These reactions typically appeared around 5 days after the injection. A rash was also reported in 2.3% of patients. This side effect may occur up to 14 days after treatment. These common side effects are usually temporary and resolve on their own. Serious hypersensitivity reactions, including anaphylaxis, have been reported with other human immunoglobulin G1, IgG1 monoclonal antibodies. While not specifically reported with Enflonsia in the provided data, this is a known risk with this class of medication. Healthcare providers should be prepared to manage such reactions. Appropriate medications and supportive care should be initiated immediately if a serious hypersensitivity reaction occurs. Signs of a serious allergic reaction require urgent medical attention. Parents and caregivers should be educated on what to look for. Enflonsia is contraindicated in infants with a history of serious hypersensitivity reactions. This includes anaphylaxis to any component of Enflonsia. A thorough medical history is essential before administration. It is vital to recognize the signs and symptoms of a serious allergic reaction. If your child exhibits any of these signs after receiving Enflonsia, seek medical help right away. Prompt action can be life-saving. Signs may include swelling of the face, mouth, or tongue. Difficulty swallowing or breathing is a critical symptom. Unresponsiveness or loss of muscle tone, going floppy, is also a severe sign. Other signs include a bluish color of the skin, lips, or under the fingernails. Muscle weakness can also occur. A severe rash, hives, urticaria, or intense itching are also indicators of a potential serious reaction. Clesrovumab C4, the active ingredient in Enflonsia, may interfere with certain types of RSV diagnostic tests. Specifically, it may interfere with immunologically based RSV diagnostic assays, such as rapid antigen tests. This interference could potentially lead to false negative results. If a rapid antigen assay result is negative, but clinical observations are consistent with RSV infection, confirmation is recommended. A reverse transcriptase polymerase chain reaction (RT-PCR) assay should be used. RT-PCR tests are generally more sensitive and specific for detecting viral genetic material. It is important to note that other drugs, including prescription and over-the-counter medicines, vitamins, and herbal products, could potentially interact with Enflonsia. While specific interactions are not detailed here, healthcare providers should consider all medications an infant is receiving. Always consult a healthcare provider regarding potential drug interactions. Proper storage of Enflonsia is crucial to maintain its effectiveness. Pre-filled syringes should be stored under refrigeration. The recommended temperature range is 36 degrees Fahrenheit to 46 degrees Fahrenheit, 2 degrees Celsius to 8 degrees Celsius. The pre-filled syringe should be kept in its original carton. This protects the medication from light until it is ready for use. Exposure to light can degrade the product. Once removed from the refrigerator, Enflonsia must be used within 48 hours or discarded. It can be kept at room temperature between 68 degrees Fahrenheit to 77 degrees Fahrenheit, 20 degrees Celsius to 25 degrees Celsius, for a maximum of 48 hours within that time frame. It is important to track the time it has been out of refrigeration. Do not freeze Enflonsia. Freezing can damage the protein structure of the monoclonal antibody, rendering it ineffective. Also, do not shake the syringe. Shaking can cause the protein to aggregate, which can also affect its efficacy and safety.